CBS News political contributor Zeke Miller. He's a White House reporter for the Associated Press. Zeke, thanks for joining us. What protections does this executive order provide patients and medical personnel, and how are you going to enforce something like this?
By itself, this order doesn't do much. It directs federal agencies, the Department of Health and Human Services, the Department of Justice to take actions to try to make it, to try to provide protections for women seeking abortions in places where there are state restrictions. But by his own pen, the president can't do very much at all. What is new today, though, is the president directing the Department of Health and Human Services to explore ways of creating essentially a Medicare waiver system for states that do provide abortion services and allow that to take place, to provide abortions to women who cross state lines to their states, both to support the travel and also to provide coverage under Medicare for that. That program hasn't been written yet. The devil there will be in the details. So this is the president, sort of trying to make it strike a symbolic victory, showing his administration is working on this issue. But as the president himself has said several times since the Supreme Court ruled a couple of months ago, by his own hand, he's very constrained in terms of what he can do.
And Zeke, how is the Biden administration prepared to respond to states that have abortion restrictions if they end up claiming that the federal government is overreaching with this executive order?
That's the White House has said multiple times that federal law trumps state law. And we saw that in the case of the lawsuit filed by the Department of Justice against Idaho's restrictive abortion law that the Department of Justice is reading because it had a sort of a convoluted carve out for cases of rape and incest, or where the life of the mothers at stake could run afoul of federal law that governs how doctors in healthcare facilities are supposed to treat all patients in an emergency situation, and or a woman in labor, and that would essentially would put that law afoul of federal law, and that's sort of that fundamental of our constitutional system where the federal government trumps state law. So they're saying that's not an overreach. The one wrinkle is that there is a existing federal law that bars use of federal funding directly for abortions. The Hyde Amendment, the White House has said they recognize that is the law of the land, and they are not trying to overturn that at this moment. So how that regulation, that waiver system is written at the Department of Health and Human Services within the constraints of the Hyde Amendment will really be something that states will be following and could potentially be the subject of future lawsuits.
Okay, Zeke. So today is the first meeting of this interagency task force on reproductive health care access. So what else can we expect from them down the road?
It's going to be a lot more of these sorts of what seem like incremental steps, looking for creative ways using the federal government, the influence of the federal government working in partnership with states that allow abortion rights to provide abortion services to women in states that don't allow it, or to potentially launch more lawsuits. This is a lot of show. There's not yet a lot of substance here because this is something that was done done by the courts and took effect nationwide. A lot of the action, like we saw in Kansas yesterday, is going to take place at the state houses and then potentially in Congress. There's only so much the executive branch can do. So this task force will put out a lot of paper. They'll make a lot of statements. They'll try to regulate where they can in the limited spaces where they can. But this is more of a messaging effort on the part of the White House and part of the Biden administration to show they are taking this issue seriously. But this is not where abortion rights for would be put back in place. It's not the solution that the advocates are looking for.
Zeke, let's widen out a little bit. The president having several legislative wins this week. You got the CHIPS Act, the Burn Pit legislation, Climate and Inflation Reduction Act. Do you think that these victories are going to help his overall approval ratings?
It's certainly possible. It will be really interesting to see over the next couple of weeks how those approval ratings move, because this is, we're going to watch potentially in the next week or two the president getting a huge portion of his domestic agenda that has been locked up in Washington gridlock for more than a year now through Congress, through the slimmest majorities in the Democratic-controlled Congress. That said, the president's been burned by this process. Legislating is often compared to sausage making. The president got really in the muck in this process of the last year or so, and that's going to be hard for him to lift himself above and elevate himself and cast. He'll be able to sign this legislation, declare victory, but can he actually politically get the benefits of legislation that is essentially long-term benefits to the United States? Particularly on the chip side, there are no semiconductor manufacturing facilities that are going to be opening between now and the midterm elections. This is a longer-term issue for that the president's addressing here, and he's got a big hole to dig himself out of. This is going to take some time. It's not going to happen overnight, and it'll be interesting to see how quickly voters reward the president for getting that done.
Zeke Miller, thank you as always.